Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Tricyclic antidepressants for anxiety and chronic pain. Depression is a common but serious mental health condition that can significantly decrease quality of life and productivity. /r/n/r/n Scientists still don't know exactly what causes depression. Some factors that contribute to it include /r/n/r/n Tricyclic antidepressants, TCAs, were introduced in the late 1950s. They remain an option for people with depression because they are very effective. However, they are typically not a first-line initial treatment choice. /r/n/r/n The following article covers the uses of TCAs and safety considerations to keep in mind if you take them. /r/n/r/n If you or a loved one is struggling with depression, contact the Substance Abuse and Mental Health Services Administration, SVSA, National Helpline 800-662-4357 for information on support and treatment facilities in your area. /r/n/r/n If you are having suicidal thoughts, dial 988 to contact the 988 Suicide and Crisis Lifeline and connect with a trained counselor. If you or a loved one are in immediate danger, call 911. /r/n/r/n As their name implies, TCAs are medications that contain 3 rings and a side chain. /r/n/r/n They work by increasing levels of serotonin and norepinephrine, chemical messengers in the body that help regulate mood. Low levels of these neurotransmitters are associated with depression. /r/n/r/n Beyond anxiety and depression, TCAs are used off-label, meaning they've been proven to help but have not been approved by the Food and Drug Administration, FDA, to treat the following conditions. /r/n/r/n TCAs available on the market include the following medications and recommended dosages for depression. /r/n/r/n Keep in mind that TCAs are often dosed lower for other conditions than they are for severe depression. These lower dosages are effective and carry a lower risk of side effects. /r/n/r/n TCAs inhibit serotonin and norepinephrine reuptake in the brain. This means that TCAs increase the levels of these chemical messengers in the brain to counteract depression symptoms. /r/n/r/n In addition, TCAs have analgesic effects. They reduce nerve pain by increasing norepinephrine levels in the spinal cord. /r/n/r/n It takes about 2 to 4 weeks for symptoms of depression to improve after starting a TCA, but beneficial effects on chronic pain may be seen within just a few days. /r/n/r/n TCAs combat depression and pain in a similar way to a newer class of antidepressants known as serotonin norepinephrine reuptake inhibitors, SNRIs. Prescription SNRIs include Effexor, venlafaxine, and Cymbalta, duloxetine. Like TCAs, SNRIs increase the levels of both serotonin and norepinephrine. TCAs and SNRIs are helpful for chronic pain, as well as symptoms of depression such as /r/n/r/n The other major class of antidepressants prescribed is selective serotonin reuptake inhibitors, SSRIs, which increase levels of serotonin only. SSRIs do not treat chronic pain. They are most effective for symptoms of depression like /r/n/r/n TCAs work about as well for depression as newer antidepressants like SSRIs and SNRIs. But while each of these classes have some serious side effects to be aware of, TCAs are considered more dangerous in an overdose. /r/n/r/n The use of TCAs has decreased since the discovery of other classes of antidepressants beginning in the 1980s. TCAs are still used to treat major depressive disorder, MDD, though typically only if other classes like SSRIs and SNRIs haven't worked. /r/n/r/n TCAs are generally not used for mild depression, but they may be helpful for severe cases. Symptoms of severe depression can include /R/N/R/N2 TCAs, tofranil, imipramine, and anafranil, clomipramine, are also used off-label for anxiety disorders like generalized anxiety disorder, GAD. Although they're effective, side effects limit their use. For this reason, TCAs are generally only used if other medications like SSRIs or SNRIs haven't worked. /R/N/R/N TCAs are very effective against neuropathic nerve pain, which is a component of many conditions including /R/N/R/N. Many of the studies of TCAs for nerve pain have used Elavil, amitriptyline, 25 to 150 mg per day. /R/N/R/N. The TCA anafranil, clomipramine, was the first medicine approved by the FDA for OCD in the 1980s. Today, it is considered second line after trying an SSRI. /R/N/R/N research shows that TCAs are also effective for symptoms of fibromyalgia including fatigue, quality of sleep, and muscle stiffness. Again, they are typically not prescribed first line but may be recommended if other medicines haven't helped. /R/N/R/N. Lastly, low-dose TCAs are used for other chronic pain conditions including /R/N/R/N. About 3 of every 4 antidepressants prescribed for chronic pain are TCAs. But interestingly, a recent review of the research found only low-quality evidence to support using TCAs for chronic pain conditions. /R/N/R/N Tetra images, Getty Images /R/N/R/N. As a whole, antidepressant medications are known to cause side effects that range from mild to serious. /R/N/R/N. Some clinical trials have shown that SSRIs and SNRIs are safer than TCAs from a side effect standpoint. But other research suggests that all of these classes have a similar safety profile, meaning the risk of significant side effects is about the same. /R/N/R/N Potential side effects associated with the use of TCAs include /R/N/R/N. Various strategies can be used to manage and mitigate these side effects. If you are experiencing side effects from a TCA, consult your healthcare provider or pharmacist. Consider the following tips as well. /R/N/R/N. There are some important considerations to keep in mind when prescribing or taking tricyclic antidepressants. /R/N/R/N TCAs are contraindicated for the following groups, meaning they shouldn't be taken. /R/N/R/N TCAs have potential drug interactions with other medications, including /R/N/R/N. If you are prescribed a TCA, your healthcare provider may recommend therapeutic drug monitoring to make sure the levels of medicine in your body are appropriate, especially when you are starting treatment or if you're changing doses. /R/N/R/N If you take high doses of TCAs, above the recommended amounts, discuss with your healthcare provider whether you need electrocardiogram monitoring, EKG, to monitor for heart abnormalities. /R/N/R/N Be sure to discuss treatment safety and effectiveness at follow-up appointments, or with your pharmacist. /R/N/R/N TCAs have been used to treat depression since the 1950s. They remain a treatment option but are not usually prescribed first line due to potentially dangerous side effects and the risk of death that's associated with an overdose. /R/N/R/N If you are prescribed TCAs for depression, anxiety, or another condition, keep in mind that these medications can cause side effects. Common ones are constipation, weight gain, and sedation. More serious ones include seizures and heart problems. /R/N/R/N In general, older people and those with heart disease or epilepsy should not take TCAs. These drugs may also be dangerous during pregnancy. /R/N/R/N Because there are many options for the treatment of depression and chronic pain, be sure to discuss your symptoms and goals with your healthcare provider to optimize your therapy. If TCAs aren't for you, there are many other medications that may help. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.